Picture this. After class, a student approaches you and says, I just don't feel heard in any of our group discussions in class. So, what did you do? Welcome to Off Syllabus with Manny, where we explore the hardest parts of teaching, the ones that never make it to the syllabus. Today, we are diving into voice care and communication equity. Joining me is Clarion Mendes, Clinical Associate Professor in Speech and Hearing Sciences. We will talk about how to support students and help them learn how to listen, respond, and include diverse perspectives in the clinical setting. Okay, welcome today, Clarion. How are you doing today?
I'm doing well. Thanks for the invitation. We're so excited to get winter break started, but I'm very glad to be here.
Yeah, and I heard a lot of great things about all the work you do. So I'm excited to learn more about this and share it with everybody around. So, what sparked your passion for making communication equity such a central part of your teaching?
I love that. So I am motivated by the mission statement of the American Speech Language and Hearing Association. So that certifies speech language pathologists like myself. And the mission statement says that our job is to make effective communication a human right, accessible and achievable for all. And so this could be for an individual whose ability to express themselves was robbed due to having a stroke. It could be for somebody who stutters and is just fed up with being interrupted all the time. Or it could be, a young child for whom communication looks different. Maybe they benefit from the use of a speech generating device in order to communicate.
Yeah, so for anybody listening who is not quite aware of this framework, so could you define what communication equity means in your field?
That's a very big question, and I don't know if it's easily definable, but it's basically kind of recognizing that everybody's style of communication may look a little bit different, and everybody's ability to express the same message might look a little different. And so for some people, that may be communicating through a signed language. For other individuals, it may be that we give them a little bit more time to express their wants and needs. For other individuals, it might be using a synthesized voice to help make their communication needs and wants be known because maybe their larynx or their voice box doesn't work like yours or mine does. Oftentimes, we may look at using technology in speech as unusual or different, but I'd also like to advocate that we all code switch. We all use different styles of communication. It could be texting, it could be reading, it could be writing. And so in thinking about equity, I'd also invite all of us to think about how our styles of communication vary depending on who we're talking to or what the mode of communication might be.
Yeah, and I'm along those lines. Like now I'm going back to home, and I don't know, maybe it's a Hispanic thing, maybe it's a Puerto Rican thing, but we just talk with our mouth and faces all the time, and it's right there, and all these things. So yeah, it's a different type of communication, and I feel like sometimes we could potentially even put them in different levels, right? Like this is the right way to communicate, and maybe not the right way to communicate, which shouldn't be it, right? But maybe it's going too much to a side conversation. um, Something else that I know that you do is you work around voice care.
Mhm.
So, how does that connect to how does voice care connects to communication equity, and how do you champion that in your clinical practice?
So voice care found me. I didn't find voice care. It was all very serendipitous, and I could talk about it all day long, but I promise I won't. So voice is very personal, and our voices are as unique as fingerprints are. And I don't work in forensics, and so I find voices much more interesting than I find fingerprints. But the way that equity is involved here is it's really humbling, and it's really an honor to help individuals find their individual voices. It's very humbling to help people feel empowered to communicate in a way that they previously did not think possible. And so it really comes down to equity for me often equals empowerment, both for my clients as well as for my students.
Right. Yeah. So you have been training future speech language pathologists for many years. Can you walk us through a strategy you use to help them prepare for inclusive conversations with all clients?
Absolutely. So I wouldn't call it a strategy per se, but a theme that I try to keep front of mind is what I call compassionate curiosity. And so what I mean when I say compassionate curiosity, it's thinking about our clients as individuals and really learning about them as human beings. And when I say compassionate curiosity, it's because any questioning we have about them as a person should be out of wanting to learn more about them as people. So, if I were to impart that into a strategy, a tool that I use for inclusivity, it's remarkably simple but easy to overlook. So, I would invite listeners to think about um, I'm training students to be future healthcare providers. And I want you to think about situations where maybe you've been in a healthcare setting. What kind of questions are you asked? Oftentimes they're very rushed. Oftentimes they're very um, deficit based, or imagining that you're only one small part of you rather than a whole person. And so it's remarkably simple, but when I'm doing an intake or I'm working with a client for the first time and I have students with me, um, students expect a lot of medical questions, medications, injuries, chronic health, surgeries, that kind of thing. And we do ask those questions, but students are consistently surprised at how much time I take asking about hobbies and interests. And so, what makes this person tick? What's motivating to this individual? So, this remarkably simple tool, sort of making sure that we do a deep dive into these hobbies and interests, strips away the diagnosis. It strips away that deficit. And it also potentially becomes a really nice equalizer for students and clients to think about how can we connect with one another so that we can be a team to help you achieve your goals.
Thanks. So you train them on this framework. Have you heard from them about any of the challenges that they might face, like trying to like build that trust and that connection with the clients? And how do you help them like go through those challenges so they can like master that skill?
That's a great question. So another piece of it that I incorporate as well is students are often a little bit timid to do this because I don't know if you've experienced this in your teaching, Manny. Students are terrified to be wrong. They're
Yes.
terrified of showing situations where they might be wrong or ill-informed. And I always find that amusing to me because if you knew everything, you wouldn't need to be in school, right? Like that's part of it. And so something they see early and often is me saying to a client, I don't know everything. And if I make mistakes, if you feel empowered enough to do so, please correct me because I'm here to learn along the way.
Yeah, and that reminds me of like my teaching as well. Like when you start teaching, like very early in your career, like you always feel like you need to know the answers to everything,
Mm-hmm.
and it takes strength to be able to go to class and be like, yeah, I do not know, and we're gonna learn this together. It's there's something about being vulnerable that sometimes is difficult to master, and it requires practice, which is important for this framework about engaging in civil discourse, because like that puts you in places when you feel vulnerable, and often people don't want to engage in difficult conversations because it's not an easy place to be.
Mm-hmm.
Yeah, so for faculty who are outside for speech and hearing sciences, maybe somebody teaching chemistry like me, or engineering, or literature, how could they borrow or adapt this idea to their classrooms, from clinical setting to the classroom setting?
Great question. And I will admit sometimes I'm a little fortunate from the standpoint. I'm often working with smaller groups, right? I'm often working with smaller groups, and I realize that some of the tools I may use may not translate easily into like a large lecture setting or something like that. I would invite everybody to think about having their own compassionate curiosity statements. I know this is off the syllabus, but this is something that I do mention sometimes in my syllabus, but often in my group meetings with students and within the classroom and that kind of thing. And a couple ways they can do this is we talked earlier about how everybody has very different styles of communication. One thing that they can do is if they're having students, inviting them to ask tough questions or inviting students to talk about things that they don't know, those uncomfortable or vulnerable conversations, making sure that there are multiple avenues for students to ask that question within the classroom. Meaning, can they say it verbally? Can you have something I will use often is putting little index cards or Post-its throughout the classroom that may not necessarily get put up on the wall or that kind of thing. But I might say, I recognize that you have questions that you might not feel comfortable saying out loud. So I'm going to have everybody write something on this note card. And that way, too, if somebody's writing on that note card, they don't feel like they're the ones doing it. I might have other people draw me a picture of a flower, or, it could vary. But making sure that there are multiple styles of communication supported for those difficult questions when we're looking at compassionate curiosity.
Yeah, and this sort of aligns with my next question. So I'm gonna tweak it a little. So I wanted to see any other tips you might have for people, but I also wanted to know if I'm thinking about having these like multiple ways of communication or engagement in my class. Do you have any suggestions on like how many ways or which are your top two ways? Like do it verbally or do it by like writing, like any type of framework strategy that people can just be like, okay, I'm gonna give students these type of opportunities.
That is a great question. I think that typically what works really nicely is to have one opportunity where it's very individual, where it can either be verbally or written on Post-it or index card. And then alternatively, also have at least one opportunity with curated groups so that students can have the opportunity to maybe expand that communication into that small environment. Another way that I also like to explore vulnerability is having students, especially if it's a topic they're unfamiliar with, instead of telling me what they know, or even instead of asking me questions. A couple of weeks ago, I was in the classroom and I was teaching them about something that I don't explore very often, which was amyotrophic lateral sclerosis, or ALS. And they were working on a case with an individual that had ALS. And this was in the classroom, so they had time. They weren't actively treating this person, right? It was they're working through. And I said, okay, by the end of the day, I want you to tell me 15 things you don't know based on this particular case. And for the first time I had seen in a long time, the students were super excited to be vulnerable because they were showing off what they didn't know in a way that they hadn't felt comfortable doing so previously.
I love that because also there is no right answer to that either. Is what you know or what you don't know. So it is you're vulnerable, but you're on. It's low stakes.
Exactly. And it helped me to think about, okay, going forward into the future, what might students need more support with versus less support?
Yeah. Thank you. That was fantastic. Anything else you want to share before we wrap up?
Let me think. Well, I'm just going to put it on audio there because you and I were talking about this via email the other day, is because a big theme of the faculty retreat this year is vulnerability. I've also adopted the mantra at times with students, I will let you flail, but I won't let you fail. And that's from the standpoint of giving the students the space to make mistakes, but in a supported way that will not cause any harm to their clients or any harm to themselves, and help them iteratively understand what it's like to be a clinician.
And it connects very well with our conversations about being vulnerable and being flexible and like growing through these experiences. So thank you for looping all of that back into the episode. So big thank you, Clarion, for joining me today. This was fantastic. I did not know much about this framework, so it's very useful to learn more. And I love the fact that they're very applicable to a lot of different disciplines. So thank you. For everybody listening, we'll have some resources in the link below. And remember that teaching goes beyond what's on the syllabus. Thank you.